Good morning. Dr. Krista here from the American Posture Institute, and I am connecting you with an amazing CPN, Dr. Jonathan Streit. Dr. Jonathan, can you tell us a little bit more about you, where you practice, and where you're from?
Absolutely. Thanks for having me on. Well, I practice in Wichita, Kansas. I work at a facility called the Hansa Center. We primarily focus on people with chronic illnesses. They typically come to us for a minimum of 2 weeks for an extended stay. So we have people from all over the world, all over this country for sure. I practice a little bit differently than most of maybe your CPNs do, but I'm really loving what I'm able to do with posture neurology in my style of practice.
Love it. Now, we're going to dive in a little bit deeper about how you practice and a lot of the patients that you're seeing in terms of their chronic diseases and their case presentations. But
Sure.
before we do, tell me, why did you decide to do the postural neurology program, considering with your target audience? What made
Sure.
you decide to implement postural neurology?
Well, number one thing, when I'm working with our patients, and remember, chronically ill, we get the patients that have fallen through the medical cracks. So sometimes it's a very bleak outlook for a lot of these patients. Now, something that's cool is we use laser, we use pulsed electromagnetic field therapy, we use nutrition response testing. We do all kinds of different things. We were missing one valuable target, and that's the human brain. And how it is that we can integrate the individual parts, how the body responds, and I took that on as one of our physicians here to bring that to our patient base. And it's been super cool, super interesting. The other docs that work here in the facility with me have all kind of, learned from what I've learned from you guys with regards to how they can test in their room with their individual patients' needs. So
Nice.
it's been really amazing.
Good. I'm so happy to hear that. And, just to pinpoint one of the things that you just said, there's a lot going on with human physiology. We completely understand that we're complex organisms, complex systems. But at the end of the day, the brain does control all physiology, all aspects of it. So at a certain point in practice, we say, okay, we can't continue to ignore the brain if we want to get these long-term results that we're hoping to get with our patients. So were you skeptical at all about doing postural neurology?
Actually, no. I've started going through the DAPC program for clinical functional neurology,
Uh-huh.
and when you go through 7 of the 2,000 modules that they have, you're kind of like, what am I gaining here? Obviously, a ton of knowledge, but it wasn't an applicable thing for me. I'm not trying to figure out lesions. I'm not trying to figure out that I need a functional tool in order to affect these patients, because they've been through all of the MRIs, they've been through all of the neurologists, they've minimum of 20 doctors that they've seen across the nation. So the diagnosis aspect is already taken out. Now they need a functional method to bring them back to health, and that's what we deliver.
Oh, I love that. And I love that you said that you're not focusing on diagnosis of hard lesions. What we're focusing on is getting the patient well. They've already seen
Right.
the doctors, they've gotten the diagnosis. Now it's about how can we add more function to their life and, of course, increase their quality and the quantity of their life as well. So thank you for
Absolutely.
sharing that.
Absolutely.
And then what results have you seen in practice since implementing postural neurology?
Oh my goodness. Well, remember, I'm already using odd techniques, but one, for instance, if you don't mind me just sharing this patient story with you. 18-year-old girl. A lot of CPNs have probably heard of the term POTS before. Orthostatic hypertension, that type of thing. But this patient had a very unique story where it was the first 2 weeks that she was here, wheelchair bound, couldn't actually, sit up because she'd want to pass out. Started implementing different neurological things that I was already doing before, but because of what I've learned through posture neurology, the integration of using the eye, the integration of doing other things rather than just the normal chiropractic neurological testing, some pretty cool things started to happen.
Nice.
Now, minus just the fact that a miracle may have occurred in this office, but that young woman got up from her chair and she started walking across the floor. Now, that walk was an extremely odd, she hasn't really walked in 4 or 5 years. And so it was very, not antalgic, but not a proper gait at all. But I put dots on the floor. Now, I got the idea from listening and trying to integrate what you guys are saying with vocal, keep an eye on, look at this, or do different things with your eyes. And so I put dots on the floor. I said, I need you to create a motor plan, just explaining it to her as I was going. And I'm like, I need you to step on that dot, step on this dot, step on that dot. And sure enough, by the 5th dot, she was walking normal again. Now, can you get that every time? No, obviously not. And so there was a lot of other things that we had done prior to this. But the fact that I was, thinking about that because of what you guys are doing, I think is quite amazing. And there's more stories than that. I mean, it's one of a couple that really stick out in my mind with regards to the power of neurology and the power of functional ability to change these people's bodies, change their mind. I mean, we changed this girl's life, so it was really cool.
Absolutely. That's a phenomenal example. Thank you for sharing that. Honestly,
Absolutely.
When we hear stories like that coming from our CPNs around the world, it's so fulfilling. It makes everything worth it from our end. And it just makes us want to be able to share this with more people because, you've changed one person's life by allowing, giving them the ability to walk again and then walk in a more coordinated fashion so they can go throughout their activities of daily life. That is truly life-changing. So thank you very much for sharing that example. And as you mentioned, you already had a great clinical skill set. What postural neurology did is provided you with more tools for your clinical tool belt. Now, each patient is going to be different. They're going to present with different signs and symptoms and different case presentation. Having that wide array of tools to choose from, to pick and choose from, to apply to each patient is so important. So that's such a great example. Thank you again for sharing that.
Absolutely.
So how has postural neurology then impacted your practice overall?
Oh, well, think about this. So all the things that we have been doing before, using laser and all of this we're doing while we're working with the patient. So I see a patient for an hour a day, and then they go and do 5 or 6 hours of different therapies throughout the office. That's their day here, their typical day. So as a patient is laying on this table in my office, we're able to utilize that neurological, that functional neurology in with what I'm doing with them as I'm going through. So if we're looking for bacteria, virus, parasite, whatever we're looking for, I can throw it through a filter of neurology, which I wasn't able to do as accurate as I was before. And so what I've learned through what you guys are doing has really went into every avenue and every aspect of my practice, which is really, really cool. And I really appreciate you guys, taking the huge leap and diverting from the norm in chiropractic neurology and creating your own thing. I think it's fantastic.
Well, thank you. And, our whole goal with postural neurology is that people can take it and implement it. At the end of the day, we want you to be able to take this course and be able to implement it with every patient who walks through the door. So that was certainly the intent with the education. I love hearing your application of postural neurology. It's just incredible how you're helping these patients.
Cool.
And Dr. Jonathan, why would you recommend postural neurology to other healthcare professionals?
Well, I think it's every patient. And now knowing this with at least my patients, testing every patient with, a quick 3-minute scan, neuroscan, all of that type of stuff, you find that everybody has a problem. So why not extrapolate that into your own practice? If you're a conventional doc, a hole-in-one doc, applied kinesiology doc, it doesn't matter because your patients have neurological deficits that need to be addressed or else true healing can't happen. So I think it has to be done. It has to be implemented in every chiropractic program, every every style of practice. If you truly do care about your patients, they need this type of work.
You heard it there, Dr. Jonathan himself. Dr. Jonathan, I want to thank you again for joining us for this interview. I just, again, kudos to you. You're doing such great work with your patients. Love hearing these success stories, especially with these chronic disease patients who, like you said, have been to so many specialists before coming into your office. So thank you for extending your education with the American Posture Institute and then turning around and implementing this information in a way that's impacting tremendously the quality of these patients' lives. We really appreciate you. We commend you. And thank you again for joining us.
Thank you.
Have a great day, everybody.